Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? I had severe asthma as a kid. I was intubated for a severe attack a few times. My parents were instructed to take better precautions in our home, and went through instructions, more dusting, washing bed sheets etc, and the big one, no smoking inside the house. So my parents agreed to all of this. Few weeks later I'm back in the hospital. A doctor recognized me and came over to talk. Then he bent over and smelled my head. I'll never forget that. I thought it was so weird. He told a nurse to sit there and not let me leave with my parents. When my parents showed up he asked point blank, "Did you not understand what I told you last time? Do you understand these attacks could be fatal? But we open windows and have stopped smoking in her room when we put her to bed." I saw a patient for a follow-up after 3 visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2 to 4 hours with no relief. This raises suspicion to me, as the same meds are working in the air. I ask him to show me how he is using it. He holds it about a foot away from his mouth, and does 2 puffs like Binnaker and swallows. I felt really bad. He had never received any education about his illness or medications. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying, like as a solid would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way, since she's now handicapped, and it wasn't to help her walk on her post-op knee. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics, but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor. There was a nursing student I had once who laughed loudly and exclaimed, "How can you possibly get an STD in your mouth? AHH, the innocence of youth." My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. That coming to the earth for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the earth for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the air with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. Patient comes in at 2 AM for insomnia, clearly tweaking her brains out. Heart rate 200. Can't sit still, bouncing off the walls. I suggest maybe easing up on the cocaine. But doctor, I love cocaine. That the 30+ cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. Nurse here. Retired after 27 years on the job. The number of American 20-somethings that don't know if they are circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, "Are you circumcised?" If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, "What's that?" is way too many. For the record, I can count the number who were uncircumcised on 2 hands. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went BC. It doesn't bother her, and she'll see if it gets better. Had a patient in a high priority area 40 kA. Sugar was in the 800s. Stomach pain, nausea, vomiting and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. A 32-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. My dad's answer: I'm not a doctor. My dad had to tell a patient that they were not pregnant. The patient was male. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo, and doesn't only attack cancer cells because it likes the acid environment in it. My sister, who is a new Redditor and hopes sees this, is a doctor, and 25 years ago, when she had her very first patient out of residency, and this patient refused to allow her to see her breasts, which were sore, and needed a mammogram to check out a lump. So sister asks why, and this girl, who is about 30 and single, said matter-of-factly, "Oh, that's lesbian. We can't do that. It's against the Lord's wishes." She loves telling this story at the dinner table on family gatherings, especially to our religious side. Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. So when cats and dogs eat grass, that means they have cancer, right? Me, no it does not. Made for an awkwardly silent ride the rest of the way. Had to explain to an adult you have to brush all the sides of a teeth. Like, no, just the side that shows when you smile is not enough. And yes, flossing is not just a thing for rich people. This one is a little different. My dad is a pediatrician. He told me the story of a teenage boy, around 13y/0, who was referred to him something unrelated, can't remember what. When he asked him if he was on medications, the boy's mom pulled out some birth control pills. Apparently his family physician suggested birth control as a way to treat his acne. Yes, you read that correctly. A licensed doctor told a teenage boy that was just going through puberty to take female hormones as acne treatment. I think he had been taking them regularly for the past year. This is kind of the opposite. I'm a patient and went to a doc in the box because I hurt my foot and I have diabetes. Foot injury should always be checked when you have diabetes. The doc at the urgent care pricked my finger and saw that my sugar was 150. I just had lunch and my normal is between 120 and 150. He told me I had to lower it and said I should drink a Coke because Coke always regulates people's sugar for some reason and he doesn't know why. I say no thanks and he gets all mad cause he's the doctor and doesn't want me to leave until my sugar goes down. I called my real doctor while he was out of the room, and after getting yelled at for going to a doc in the box, he said he'll take care of it. 2 minutes later the nurse came in and I was free to go. I didn't see the drive on the way out, either with a different patient or avoiding me. He'll never go there again. Edit. A doc in a box is any urgent care facility acting as a primary slasher, but not quite either. Son of a physician here. Was told an interesting one a while back. Basically, there were some patients who would have rings put around the top of the stomach in an attempt to make it so they couldn't eat as much food. They'd get sick if they had more than could pass through the ring. If I recall correctly, the idea was that this would help in reducing weight in patients who drastically needed it down so as to help with their health issues. Well, some of them would learn that if you ate only a little over what the ring would allow at a time, you'd eventually be able to eat ridiculously large servings again. This was because the ring would stretch out over time. You can imagine what the conversation between doctor and patient was like when the doctor found out what the patient had been doing.